Good morning. Good morning. You're welcome to our today's class. We are still on the course PTP 111, Introduction to Principles of Pharmacy Technician Practice. So the topic for today is roles of pharmacy technicians. Roles of pharmacy technicians and the relationship with pharmacists, other healthcare professionals and patients. Roles of pharmacy technicians and the relationship with pharmacists, other healthcare professionals and the patients. You know, is a triad. The pharmacy technician is there. Pharmacy technician has a relationship with other healthcare professionals, with pharmacists inclusive. Then with who? Patients. So it's a triangle. So today we are going to look at the roles of pharmacy technician and how pharmacy technician should relate with other healthcare professionals and patients. So that's what we are going to look at today. So as I pointed out at the beginning of this class, attendance please. Thank you. No, continue. So as I pointed out, I said that pharmacy technicians work in diverse settings. They work in hospitals. They work in community pharmacies. They work in different areas of pharmacy, even in academic sector. Here now, pharmacy technicians work in schools of pharmacy technician, departments of pharmacy technician in various colleges of health technologies. Even in PCN office, pharmacy technician also work there. So, having that at the back of our mind, it's clear that pharmacy technician work with other healthcare professionals, even with have a relationship with other healthcare professionals, even with what? Patients and other clients, depending on where they are working. So, pharmacy technician assist pharmacists by handling technical, clinical, and clerical tasks. Technical, clinical, and clerical what? Task. So, why it's important to do so is that it enables the pharmacist to focus on direct patient care. Because a patient, remember we said that pharmacy has evolved. There's a paradigm shift from just products to what? Patient care, right? For pharmaceutical care. So, a pharmacist will not have a patient he should give attention to and be carrying cartons of drugs up and down and be counting what they have in shelf and be counting good morning tablets, and while a patient the pharmacist should sit with and discuss drug therapy. I don't know if you understand where I'm going to. So now pharmacy technician is there to help assist pharmacists in doing all those things. While pharmacists will have more time to focus. How many pharmacists do we even have? The pharmacist is not enough. I'm not even talking about those that are jabbering in this country. A lot have gone. Even some of my colleagues are even wondering what am I still doing here. But if all of us disappear, who will be here to train and to take care of our people? Everybody must not run away. That's the point. If all the medical doctors, boom, all the pharmacists, boom, all the nurses, boom, here will be a dead zone now. The way I reason is this may sound awkward, but it's reality. If everybody is living, it's a problem. We are facing serious problem, but we don't even know. A lot of people now, those that are living, their grandmother, their mother are here. Who will take care of them? That's the point. So we hope that things will get better, but it makes no sense if everybody is disappearing. So what am I making? Even if those people that have left come back, it's still not enough for pharmacists, and not even enough to take care of our population in this country. So now, that's the pharmacist that the patient, the pharmacist should interact with to take care of the drug therapy issues. The pharmacist will leave the patient and be counting medicines and be checking how many, the expiry date of what they have in stock. And if the company supplies, you leave patient and come in, you go and be carrying drug, sending them to be arranging them, taking stock. No. So have you not seen the importance of it? So the pharmacist will now have time to focus more on what? On direct patient care. Then if there's need for maybe one or two things that the pharmacy technician wants the pharmacist to help to address, he can just address it and have time for that. Am I communicating? So the technicians, see, if anybody, sometimes I wonder, some technicians complain that where they went to the IT, the way some pharmacists treat them, I don't know. I've not seen directly where I've not seen, because if I see any pharmacist maltreating any pharmacy technician, I'll finish that person, because the person is ignorant. To me, I've not seen until I see one. I hear and I advise them. Just know your limit, do what you should do. I made them to realize their importance in the pharmacy profession. But I've not seen. But any day I'll see, even those that I've seen speak ill. I finish them off. My colleagues, I finish them off. But I've not seen anybody directly maltreating. That person is ignorance. If I may borrow the word, I don't know whether it will sound so harsh. It's foolishness to me, because these are the people that will help you to do what? Do your job effectively. Then you are there fighting with them. Are you normal? To me, that person is not normal, or the person is what? Ignorance. So what am I saying? Pharmacy technicians support the stability and growth of the pharmacy profession. I don't joke with that. So it's important you know who you are, know where you belong, and maintain that status. And I think also another problem with time, you find another problem also that makes some pharmacists look as if they're having issues with pharmacy technicians, is that some pharmacy technicians not even know their boundaries, where they should operate. Some don't even know, and it's also a sign of ignorance, because if you are empty, you just be doing nonsense. But if you are loaded, if you are loaded, you'll be humble. You know exactly where your limit is. The only thing you can do is that you will aspire to be like this person. You start looking for how to study what, to go further, to do what, be like the person, not to be doing like this. If they ask you to do this, you'll be like. So why wouldn't the pharmacist be hard on you if you are doing nonsense? So it goes both ways. So I want you to understand that. Now let's look at the roles of pharmacy technicians. Let's look at it. We look at the roles of pharmacy technician let's look at the hospital setting. Come, once the lecture enters, you don't pass through the front, okay? Come. Close the door. Bolt it if it is possible. Okay. Thank you. So let's look at pharmacy technician in hospital setting. So what do they do in the hospital setting? In the hospital setting, pharmacy technician help to manage inventory and store control. Manage inventory and what? Store control. So everything that comes into the pharmacy, they store what happens there, what the stock they have. In fact, if pharmacists want to find out what we have in stock, you just call the pharmacy technician. Please check. He may sit down one place, check, please, let's see what we have. Pharmacy technician will not be there, and the pharmacist will get up and be unless the pharmacy technician doesn't know what he's doing, or the pharmacist doesn't trust what the pharmacy technician is doing. That's when you see the pharmacist will go and be checking the stock and be. But once the pharmacists have the trust that you know what you are doing, trust does not necessarily mean that you are telling what they have. Trust is that you don't have what it takes to do this. Am I communicating? Yes. He may not trust your capability. It's trust. You know, whatever you say trust, we think it is all about stealing. No, it goes beyond that. Trust your capability. You are able to do it well and not put him in trouble. Because if you enter there and do nonsense, if problems start, it will be on the head of the what? Pharmacist, not your head. Because the pharmacist is the one in charge. So if there's an issue there, it's the pharmacist that will take the hit. So a pharmacist that don't trust, that you don't even know the name of drugs, you don't even know the dosage form, you do nothing, and you don't know why they sent this human being here, will not allow you to do it. He will subject you to this sweeping if some may not even trust your ability to even keep the place clean self. You just be there like robots, be receiving monthly salary, pressing phone. Then one day if you press phone too much, the management will catch you and sack you. They'll say that you are not working because the pharmacist doesn't trust what you can do. So what am I saying? Here you build yourself. Here you do what? You build yourself. You know, any boss that want to deal with you, especially a boss that is still under boss that take final decision, want to deal with you, he won't allow you to work. He will do silently. He won't talk to you. He will be doing what he should be doing, waiting for the day the management will catch you pressing phone or wasting time walking around. Because when you are not doing anything, if you don't have anything to do, you start walking around, and they will, one day they say, this one is not doing anything here, please. He's taking our money every month without doing anything, so let us even suspend him and see whether work can continue. And they will suspend you and work continue as if nothing is happening. Then they will not decide that this one is not doing anything. Let him or her go from that suspension and go. So if a boss that want to deal with you, he won't allow you to be there anything, and you think you are enjoying. One day, the organization will now understand that you are doing nothing. So any place you are working and you go for leave, and you go on leave and their absence is not felt, you are not contributing anything to that place. Are you aware? And that organization can easily pay you off. Maybe they pay you 1 month extra. Once you hear pay you 1 month extra, you are going. So what am I saying? Build yourself now, so that anywhere you see yourself tomorrow, even though nobody is indispensable, but you become relatively indispensable. I know what I'm saying. Any place you step your foot, you make impact that you become relatively indispensable. Even if you do something wrong, if they think of sacking you, they'll be like, but this lady, this guy is no, we can't just sack him like that. Call him, let's know what his problem is. Someone that did something wrong, I said, no, just call him, let's know how we can help him go. Let's see what his issue is. Why? Because they know that you are relatively what? Indispensable. Instead of sacking you outright, they will not discuss with you, find out how to advise you to do better. Why? Because of the impact. But if you are just there constituting nuisance, you are contributing nothing, and you make a mistake, bam, you are going straight. You are going straight. So what am I saying? If you build yourself now, that's when you know what to do, how to make impact tomorrow. So the pharmacy technician also record and dispense prescriptions. Is that clear? They record and dispense what? Prescriptions. Yes. Even if yes, that there is not, it may not be primary, but sometimes that's why you study all these courses you have. What are you doing? What are you discussing? No. You pay for handout in my class. A class is going on. You're asking whether you pay for handout. Instead of listening to what I'm saying. Oh yeah, you. I'm talking to you. Come here, fast. Fast. See. Whenever I see FCC is playing, I'll just be laughing. I'll just be laughing. With time, you understand why I'm laughing. With time, you understand why I'm laughing. One at a time comes, you say, yes, now I understand why this man was laughing. Each time we are messing up in class. Continue joking. They play. So, they also counsel patients on some issues. Is that clear? Yes. That's why you should know some things about pharmacokinetics. That's why you should do it in your AUM, and some minor things about how drugs operate, how drugs act, interact, and with, so that there are some situation you see yourself, you'll be able to tell patient one or two things. At least you can tell patient, take this one every 6 hours. It's not true. You can say, take this one after meal. So it's not a clinical decision as such. It's what you should know. So they can counsel patients. Then they also package, label, and prepare extemporaneous products. They package, label, and prepare extemporaneous products. That's why from your second year now, you start your dispensing practical. Extemporaneous preparation. First semester, second year, you start it. We are doing it. I'm doing it now. I am the one handling the practicals, both the second year and the final year. So I'm doing it now with those in first year, in second year, and the final year now. So you learn the skills, know what it takes, because you may see yourself in a place where they prepare extemporary, even though good morning, but it's not necessary because it's a distraction to the class. Okay, please, once I'm in class, once class start, don't greet me. No, it's not necessary. Is that clear? It's distraction. Okay, just walking. I understand. Is that clear? Please, once class is on, don't greet me. Just walking. It's okay. The only thing you can do, you can raise your hand. Then I'll permit you. I'll give you sign to come in. Okay? Maybe when you see me outside, you can greet. You can even hug if you wish to hug. But in class, the distraction. Okay? All right. So now, but through the dispensing practicals, you learn the skills. Is that clear? Because there are some, even though prefabricated dispensing has taken over, but there are still, you know what I mean by prefabricated, right? Those ones that they have already produced in the pharmaceutical industries and packaged in tablets, in capsule. You have it in your shelf, bring it out and give to patient. It's taken over, but there are still extemporaneous. You know what I mean by extemporaneous? There are still some pharmacies that still do extemporaneous preparation. There are still some hospitals, even though they are not much anyway, there are still that still have where they prepare. So you don't know where you see yourself tomorrow. That's why this thing you are doing, and apart from that, the skills you learn in your dispensing, tomorrow you may see yourself in a manufacturing outlet where they manufacture prefabricated products. In such place, the skills you learned in dispensing practicals will help you. It's the same thing, but there they do it in large quantity. It's the same thing, it's the same scale, the same reference book they use, but in there they do it in large quantity. All you need to do is to enlarge the formula and do your thing. So they also provide, pharmaceutical also provide drug information to hospital units. Yes, they also provide drug information to hospital units, even to patient too. A patient may come to you. That's why you do your AUM. A patient can come to you to ask you one or two things about a particular drug. At least with their level, you can operate within the level of what you know. Is that clear? In fact, some pharmacists can even go extra mile to study. That's why I encourage my students, you do not just limit yourself to this thing they call handouts. for pharmacy profession is not a handout profession, but it's also good I give it out sometimes, because for those that know the meaning, it gives you a guideline, a starting point to explore. Is that clear? Yes. Whatever you see in the handout, try to look for textbook. I don't know, have I mentioned here that if you are interested to join my Telegram channel where I have some textbooks, did I mention something such here? Okay, maybe I'll drop the link in your group. For those in Telegram, you can join and access any textbook you want. It will help you. Any topic you see, you see in the handout, you try to do more research on that topic. That is how to grow. Go deep into it. Don't just cram the handout. This is just summary of all the things you should know. Because if we are to, I know what I did to be able to compress it so you can pay for it. If I'm to prepare it as, I don't know how much it will cost. It will be a textbook. So it's important you study more. Don't just limit yourself. And if you do that, tomorrow you'll be proud you did. Yes, you'll be confident in yourself. So you can give drug information. Yes, because you do AUM from first year to your final year. So why won't you be able to say one or two things? Why would you be able to tell a patient that, please, why using antacid? Don't take it with drug. Antacid will not allow this to happen. Antacid will affect the acid level in your stomach, and breakdown, and the absorption will be an issue. You should be able to do that. But if you are empty, you'll not be able to do that. Sorry. So this is time to do what? Fill your drum with something worthwhile. Now, they also assist in unit dose dispensing and documentation. Unit dose dispensing and documentation. Are you aware? Did you know what is unit dose dispensing system? Have you heard of it before? UDDS. Marker, please. Class rep, marker. Have you heard of UDDS? Unit dose dispensing system. It's quite unfortunate. If you go to some hospital now, that thing is done by nurses. I'm sorry to say that. It's done by what? Nurses. UDDS. That thing should be done by pharmacists, through pharmacy or technician. That's what it should be. So you need those. Let me explain it. If I explain, then you tell me if you have seen it before. In a situation whereby maybe some patients in the ward, right? It's when you're pointing out like a land agent. What is it? You are in front and you are pointing at the back. A lecture is going on, and you came late, and you have not even brought out your writing materials to start jotting what I'm saying, and you are pointing already. So now, I said that you've seen in hospitals sometimes a patient maybe a prescription for a patient says take Toso tablet 3 times daily, right? Then the nurses will go and they be supplying those drugs. In the morning they will come with it, right? Have you noticed that? Yes. In the morning they will come with it. The patient will take, right? In the afternoon they will come with it again. Have you seen such? I'm not talking about injection, infusion. That one is different. I'm talking about supplying. Yes. Maybe in the ward they now have cupboard. They've gone to pharmacy and pick those drugs and put it in the what cupboard and be taking it out tablet by tablet and give it to the patient. By right, this is what we call unit dose per dose dispensing system. That is squarely pharmacy technician work. Or because of that, I don't reason, under normal circumstance, if it is where you have enough hand, where things are going, pharmacy technician should be on ground. Pharmacists should be on ground, day in, day out. Not stocking shelf of nurses. No. Nurses are there to administer, not to dispense. Am I communicating? If you are giving a tablet, one tablet to a patient, you are dispensing to the patient. You are not administering anything, right? You are dispensing. Dispensing is not the duty of what? A nurse. It's the pharmacy department what? Duty to dispense. Either to outpatient department or inpatient. So pharmacy technician, there should no need having that. No. It's pharmacy technician that should take it in drug trolley or whatever. When it's time to go and administer, they will go. To go and dispense, they will go and give them their drug. Or even if a nurse has to do that, a nurse will come to pharmacy technician and collect it. Or you go there at that point in time. That is unit dose dispensing system. But I don't know. I don't know. Maybe they're trying to manage cost or whatever. I don't know what it is. You look as if they will just come during the day and pick drug and go and put it in their shelf. Pharmacists, after at the end of the day, pharmacists and pharmacy technicians will go home. Maybe because of the organization, maybe they don't want to employ more people. I don't know how to explain, or due to ignorance of what it is. Yes, but in this era of patient pharmaceutical care, UDDS is very important. Also, you need to understand that. It's very important you understand that. You can study more on it. You need those dispensing system. What is it all about? So just go do research on it. In our next class, tell me what you were able to find out what from it and where you think it is being practiced currently. So I'll just give 2 minutes, 3 minutes in our next class. We'll discuss it. Is that clear? Exactly. Just research on that. All right. So now, pharmacy technicians should do what? Assist in that. Assist in what? They assist in unit dose dispensing system and documentation. In pharmacy, not just in pharmacy alone, in every profession, what is not documented is not what? Done. What is not documented is not what? Done. Look at now, as attendance is going on, right? Good. Then you do not write your attendance. Then after the whole thing, I will compile the list of those that from the list, and your name is not there. You come to me and say, sir, I was in class. I was the one sitting before in front of you. In fact, I even answer a question, but you do not write your name. You were not in the class. That's the point. So whatever is done must be what? Documented. So what is not documented is not done. A time will come, what you have in your mind may other things may make you forget what happened. But one thing, so far you documented that thing. See, if I get my diary of 30 years ago, the moment I open that place, the moment I open a particular sentence in that diary, everything that happened that day will come back to my memory. The mood I was when I put down that thing, the situation surrounding the environment where I did that thing will just come back. That is the power of what? Documentation. It's very important. So that's why as you dispense, you document. Whatever you do, you document. Very important. So then, pharmacy technician, what is your problem? Are you ready for this class? If I catch you now, I'll send you out. Sit well. I said sit well. This is the second, and if I send you out, each time I enter class, I'll send you out. Each time I enter class, I'll send you out. And I'll do that. Don't allow me to do that. Let me not catch you again. Second time. So, pharmacy technician refer cases. In fact, come here. Come here. Let me be this. Come. Shift for her. Carry your book. Where is your notes? Where is your pen? I say you should come here. I want to be looking at you. Come and sit here. Come with your bag. Sit here. See school bag. A student. See school bag. A student. They play. Student handbag. A student. She's laughing. She thinks it's a joke. She's laughing. Let me look at eyeball to eyeball. You are the one distorting her. You. You keep doing like this. I see somebody you are. Is there any issue? Are you sure? No. Wait. Are you sure? Are you okay? Are you sure? All right. So now let's continue. So pharmacy technician refer cases beyond their what? Competence to what? Pharmacists. It's only those that are well informed that know their what? Level of what? Competence. An ignorant person doesn't know the level of his or her what? Competence. Because the more you learn, the more you study, the more you know, the more you realize where your boundary is. True of us. If the boundary of your land is here and you don't know anything about that boundary, you cross it, right? So somewhere that is empty doesn't know his or her what? Boundary. So if you see any pharmacy technician dragging with pharmacists, having issue with pharmacists, that pharmacy technician is empty. He doesn't know anything. The same way, if you see a pharmacy technician dragging some issues with if you see a pharmacist dragging issues with the pharmacy technician, that pharmacist is empty. Doesn't know anything. Because if you know, you know where you know your boundary. Just as I explained, you using land. If you have a land boundary here now, and we know the boundary, we know where to stop. But someone that doesn't know anything about that boundary will just come and cross it and start building in another person's land out of what? Ignorance. So the same way, a pharmacy technician that is crossing boundary doesn't know anything. That is those that we are in school playing. And after playing, I don't know how they managed to pass and graduated. These are people that will go there. If a pharmacist will say, come here, do this, you say, why must I be the one to do it? Please go and take the stock. You'll be like, what are you doing? See, he's there, sitting down like Oga, telling me to go and take stock. That person is empty, doesn't know anything. In fact, it's a sign that the person in school. No, I don't even know how the person passed. That the people that just cram handout and pass, you just know anything. Hope you know that you can cram handout and pass anyway, but not my course. So in some, you can cram handout and pass. Yes, I've seen people that cram handout and pass. You can't cram handout and pass my course. I'm sorry. By the time we start writing quiz, you understand what I'm saying. Because soon our quiz will soon start. Once I'm done with topics, my topic will be through highest next week. I'm done, or next 2 weeks. Then we'll start quiz. That's final years. Till we'll start writing quiz and quizzes and presentations. Till your exam. So by the time we start writing it, you understand what I'm saying. So what am I saying? You need to be. Like, okay, now let me in this topic now, we in this course we also treat a healthcare team, right? Collaboration. If we don't teach you how to respect other healthcare professionals like nurses, like community health extension workers, like medical lab technician or what have you, those at your level, or even others that even above your level. If you don't understand what they do in healthcare team, you are ignorant of it. By the time you go and start working, you start having issues with them. You start looking down on them. That's why if I see a nurse looking down on other health professionals, that nurse is empty, doesn't know anything. Because if the nurse is well informed, he will know that all those health care professionals, they contribute a lot to the patient care too. That the patient is not their patient. The same thing with the doctors. If I see a doctor that is dragging, having issues with a pharmacy, that doctor is empty. He knows nothing. But if you are well informed, you understand that these people, that the patient is the what? The goal. So those other healthcare professionals are there to help you, and you are there to help them too, to take care of who? The patient. Not to fighting each other and to dragging who is superior to the other. No. Because when the two elephants are fighting, the grass will do what? Suffer. So when the healthcare professionals are there fighting one another, dragging issues, the patient will suffer. And that's what's happening in our country today. We are dragging issues and our patients are there suffering. But if we work together, we'll help to take care of what? The patients. So is this issue of referring cases beyond their competence is only those that know what they are doing. A foolish, empty entity in the name of pharmacy technician will be there, just because he feel that I don't want this patient to think that I don't know what I'm doing. You will be there doing nonsense, giving the wrong medication because of your ego. I don't want him. Hey, if you look at me now, he will think that I don't know anything. If I talk to my boss now, he will think I don't know anything. No, hey, is this girl I'm crushing on in our streets? Hey, how will I go and do as if I don't know anything? You have to do the right thing. You don't know it. It's beyond your what? Competence. You excuse me, sir, please come or please wait. My pharmacist will do what? Attend to you. That is professional. You put your ego down. It's beyond your what? Competence. It's as simple as that. So, but it's only those that actually studied here we know what they should do and what they should not what do. So the pharmacy technician also handle NHIS billing and maintain cleanliness. NHIS billing and maintain cleanliness. And where is he going to? You know what NHIS is, right? What is it? Who say yes? What is NHIS? Who knows what NHIS means? National Health Insurance. Can you tell us about it? You just tell us what you know about. Feel free. Why are you always? Are you not proud of our school uniform? This human being. See, there's hello. Come. There's something I want to let you know. Be proud of what you are doing now, the level you are now. You are nothing but a pharmacy technician student, first year. That's who you are. You just accept it and be happy. When you are contented with what you... Listen, I'm talking to you. When you are contented with what and who you are and what you have, then you can aspire for more and grow. But if you are not proud of what you are now and who you are now, I'm sorry, you cannot grow. It's when you are proud of who you are now, what you are, that's where you can put effort, get focused, and do well in what you are doing now. Journey of 1,000 miles, start from a step. You have made a step. Be proud of that step you are making now. You will not understand what I'm saying until you waste your time here and go. See, That is exactly what you are doing. Because listen, in the first place, you should be here by 8 a.m. See, it does not matter where I'm coming from. Hello? Do you know where I came from? I came from all the way from Lagos to come and teach here. But I have to. I have, listen carefully. I have to. Excuse me. Just listen. I'm teaching you life lesson. Just listen. I have to squeeze myself, manage where I'm staying, because I know what I'm looking for. I have to manage it. Where I'm staying is far below where my house, comfort of my house in Lagos. But I'm here, and I'm proud of what I'm doing because I want to impact. So you need to see life. See, it's even manifesting. See time, 8:46, and you're coming for 8 o'clock. See, it's manifesting already. And this is how the problem will start. And you are discussing. Continue. Don't worry. Continue. Don't listen to me. Continue. You've seen nothing in life. You've seen nothing. And you are playing. Continue. If years to come, you may understand what I'm saying now. But I pray you're on the right track by that time. You are.
Yes, sir. I don't know me very well. After you say I'm
wow. Come and tell me about yourself. Come. Hello. Okay, I don't know you very well. See, the only person I know is someone that is not serious in my class. That is the only thing I know about you. Listen carefully. The only thing I know about is one. Somebody that, listen carefully. Hello? Yes. You judge from what you know until you are proven otherwise, right? Yes. Until you prove me otherwise. Until proven otherwise. The only thing I know about you, and it's me they will ask about you. And the only thing I will say about you is that you are not serious. You are nonchalant. You come late to class. You wear mufti. That's the only thing you have shown me about you, nothing else. No, that's all. So what are you saying? No, I like engaging students. What are you saying now? That's the only thing you have shown me consistently. That's all. Show me something different about you. I want to see it. Excuse me. I know you. I've seen you here. So show me something different about you. That's all. If not, you are saying, "Sir, I don't know you." What else do? What else? They are not. It is what you show people. That's how they will know you. That's what I know about you. And if maybe today or tomorrow I stop working here, listen carefully to the damage you are doing to yourself. Understand it now. If tomorrow I'll leave here, remember I'm a pharmacist. You don't know the interview panel you come appear tomorrow. You don't know. And I may be there. You don't know. I've seen things you don't even know. The only impression I will give is what you gave me for these past 3 weeks. Simple. Be careful what you say and what you do. Don't just talk anyhow. You're not even remorseful. That's the only thing I know about you. And tomorrow I may not even be there. Even now, people call me on phone, different schools. Excuse me, different schools for references for different. Hello, I don't need his apology. Just listen to me. Just listen. I don't need the apology. I just want you to understand the point I'm making. So he was ignorantly and foolishly telling me, "Sir, you don't know me," without even knowing the damage he's doing to himself. You may not understand. That means you are to yourself. I have been in different panels of people I met along on my way, and I told myself, I need to be careful. And I told myself, I need to be very careful the impression I give. First impression matters of myself, because nobody may have time. See, there are some things you cannot be taught in class. I make out time to talk about it, and you are joking, playing. You are laughing. Be sorry for yourself. Be very sorry for yourself. Three of you should leave. Go. I don't want to see you here. Go. Three of you go. Go. All right, let's continue. So let's look at pharmacy technician in community pharmacy setting. Okay, sorry. NHIS, please. So let's just feel free. Just talk to us. Feel free. What you know about it?
NHIS is government approved services. A patient that registered under NHIS is allowed or accessible to low price treatments.
Okay, thank you. Does anyone here know, have anything to say on NHIS? Anybody? Okay, now, it just is, as she said, National Health Insurance Scheme. So, here now, we have other parts, we have HMO, so health management stuff, but let's focus on NHIS. It talks about, it's just a situation whereby maybe people that are working, people that are working, a specific amount of money than they register with NHIS. Is a scheme. A particular amount of money will be, they will be removing some amount of money, just like as insurance operates, from their salary. And they will be contributed in a pool of money from different individuals. Now, when any of the members maybe is sick or whatever, goes to the hospital, and no matter what it is, some cover even surgery, laboratory stuff, and even drugs, medical consultation, treatment. At the end of the whole thing, maybe the amount of money the cost may be, let's say 100,000 naira, for example. Now, because the person registered with the scheme, now from that pool of money, the person will only pay 10% of the money. The person will pay only 10,000 naira, for example. Now, so the remaining 90,000 naira will be paid from that pool of funds. Is that clear? So that means somebody may not even fall sick within a year. They will be still be taking the money from the person. Then somebody else may fall sick. Because the person is a registered member of that scheme, the person money payment will just be only 10%. The person will only pay 10% of the money. The remaining one will be what? Taken care of by the scheme. So if the person, let's say the person goes to the hospital, then of course the hospital the person goes to must be hospital that work with that scheme. So the person will only pay 10,000 naira. Then the hospital will document it. Then that scheme will now refund the hospital the remaining 90,000 naira on behalf of the patient. Is that clear? I know a friend that has that did operation. And I know that as a salary earner, at that point in time, she didn't have enough money to take care of the PA. And the cost was almost, was it I can't remember, either 400K or something. I can't remember again. She paid only 10% because she registered with what? Is that clear? And so that is what national health insurance scheme is all about. Then we have the one that is purely for government workers, that like this NHIS. They also have the private ones. Even some churches have started their own. Is that clear? But in all, it's all about taking money from the registered members into a pool of funds. Then when each of them have issues, health issues, fall sick, they will take from the person will pay just some percentage, while the scheme will now.
Is it the same thing NHIA?
What is NHIA?
National Health Insurance Agency. Still the same thing.
National Health Insurance Agencies.
But I've seen it somewhere along the side.
Anyway, I've not heard of that one anyway.
People in our parents are the same thing.
Agency.
Yes.
Unless it's a body that is maybe because of this private, those that are in private sector, a body that covers all of them, both NHIS and the other HMOs. All of them are now under the same body. Is that clear? So that is the only thing that before they were on their own. NHIS, mainly government workers. Even some states now have their own. Maybe because of the current proliferation of these bodies. We have NHIS. Everything started with NHIS. With time, states started having their own. Each of the states now have their own. Then private individuals also now have their own. So now maybe all these things are now under the agency. I've not followed up to know what is happening in the agency now, but from what you said now, it's clear that they now establish an agency that now cater for all of them. That's what I will do more research on that anyway. Thank you for bringing it up. But from my own understanding about how all this is work, it may be a body that oversees everything, both the one in the NHIS, federal government staff, and states government, and the private individuals that are under one umbrella. It may be the agency under one umbrella. So that is what. But in all, it's all about pooling of funds in one, getting funds from the members in one pool to be taken to take care of other patients, other members that are in health that need their medical bill to pay. This whole thing is geared towards access to healthcare delivery at a cost that will not tear their pockets. Am I communicating? Other family members that do not care the staff. Yes, some include, but some don't. So it depends. Some, but some don't. It depends. With these HMOs, this private one, they come with their different formats. And the private one come with their different formats. It is private now. They can sit down and decide what they want. Their own is to tell you what they do. If you want, you register. If you don't want, you go to the one that fits into what you want. Yeah, I know most of these private one have something different from even what not exactly the same thing with what NHIS is doing. But in all, it's all about putting the resources fund together. But because it's private and there are many of them, there's no it is not monotonous. You can choose anyone you want. Once you see their package and their package suits you, it's not true. You would do what? Go with them. Unlike NHIS that must be same line because it's one, so that everybody can do what? Fit in. But this one is different. So if you look at this one, you go to this one. Okay.
What about the investing of example that particular can they be forced to invest in money?
No, once you are a registered member, your own is to just anywhere you are going. Simple. In fact, you are even going to another place to work. You are even helping them to expand. Because if you go to another place, it's an opportunity for them to come there and tell them about their own destiny. There may be other staff there that may be interested in that one. Is that clear? So it's not just like pension. Pension, the one before pension was look as if it was restricted to only private, only government. But now private establishment now. Is that clear? So anywhere they are going, like me now, the pension I registered with was since 2015. But anyway, since that 2015, anywhere I'm going to work, since that 2015, once I go there, I'll just submit them. I'll just submit my pension number PIN. I ID to them. I have my pension managers. We have different pension managers. My own is a Stanbic. Anywhere, any place since that 2015, I opened it. Any place I'm going to work, if I get another job, as I'm going there, I'm submitting the PIN, the ID to them. All they need to do is just to do what? Work with it. And whatever they want to credit is entering my pension account. So it's just like that. Anywhere you're going, unless you don't want to, for this invest known to you, continue with the HMO. There's always a way to sever whatever you're doing with them. Then you go your way. But so far you see what to work with them. Any place you are going, it continues. Okay. All right. So now let's look at so in the community pharmacy technician manage store and inventory. They manage store and what? Inventory. Have you seen it again? They also manage store and what? Even in community what? Pharmacy. They record, interpret, and dispense prescriptions. They record, interpret, and dispense prescriptions. They also counsel patients and give drug information. They counsel patients and give drug information. And they also participate in extemporaneous what? Preparation. Depending on if you remember, I told you that there's some community pharmacy also carry out extemporaneous what? Preparation. And they also participate in community health what? Talks. Community health talks. Sometimes some pharmacies go for outreach. They may may even go to schools, go to churches, go to market square, depending on even some organization that is close to them for health talk. This is how they contribute in what? Community health, public what? Health education, health promotion. That's why you are doing your what? Primary health care. I think that should be your second year first semester course. They maintain documentation and cleanliness. Please, for some of you that will go to tomorrow to go and pharmacy, to go and work somewhere, maybe in hospital or pharmacy, and they ask you to not even they ask you, and where you are working, the place is not clean, and you sit down and they cross your leg, be saying it's not my duty. I'm sorry, it's your duty. I'm sorry to disappoint you. You ensure that the place is clean. That's your duty. But it goes like this. Hello? But it goes like this. Just like everything in pharmacy is the pharmacist's responsibility. Is that clear? Now, where a pharmacist, what are they talking about then? So some of you are saying being carried away by euphoria that you have entered school. Time to now do that thing you came to do. You are playing. So some are putting, some are judging what I'm saying. Some of you is copying notes that have no business with this course. Some of you is going through handout that have no business with what we are doing here. What is your problem? This thing is not normal, though. No, wait, hello, wait, no, let's think about it. You have 8 a.m. class, right? And you left your house and you now come to school. You are sitting down, that lecturer that you came to see so he can teach you is now before you. You are not doing nothing. And you think it's normal. Check yourself, something is wrong somewhere. It's not normal, seriously. Okay. See, I have important things to do. I'm very busy. If you think this lecture doesn't worth it, I will do in nomine patria filio espiritu sancto and go and stay in my office. I have things to do. Don't waste my time here. Seriously, I have things to do. I will go to my office and face other things. I have a lot of people waiting for me online to teach them too. So if you think, just save my time for me, let me go. If you think it doesn't want it, I will go. It is annoying if I'm here teaching you, you are doing nothing. I don't understand. Or is it because I'm not calling notes? I must not call notes for you. If I'm teaching, you can, if you are serious, you're putting down some point, if you are serious at all. You don't understand what? Hello? I heard, sir, we don't understand. Stand up. Let me know what they're saying. You say you don't understand what? See, that's the person laughing at the back. Oh. No, that person laughing, discussing. She said that she don't understand. Huh? No, I saw you. No, don't deny it. I saw you. Hello, I saw you. Stop it, I saw you. Can you keep quiet? I said I saw you talking. I leave my class, go, get out, go. I said you should leave, get out, go, leave. Get out of this class fast. Go. Hello? Go. Leave my class, leave, go. I said you should leave this class. Leave this class. Thank you. All right, so let's continue. I've seen 3 times chatting, discussing. You say you don't understand. And you are chatting, discussing. How will you understand? No, tell me, how will you understand when you are discussing? Very near human beings. All right, let's continue, please. You came to school, your duty is to sit down and listen, not to be discussing in class. If you are discussing, you won't understand anything. It's normal. You won't understand unless you listen. For the 3rd time, I have been watching her. For me to point her out is a serious thing. Look at this one there. Oga, what is it? Nothing. Hey, this class, very funny sort of human being. You won't understand. With time, you will. Very soon, you will understand. Very soon, you understand. Okay, let's continue, please. So they participate in what? Extemporaneous preparation and community what? Health talks. They also maintain documentation and cleanliness. I was talking about what? Cleanliness before I was distracted. See, everything that has to do. Okay, now let me use a pharmacist as an example now. Pharmacist is in charge, right? Good. Then pharmacists have other staff, other supportive staff working with him, right? Now, me as a pharmacist, I have been in a situation whereby in a place there was nobody to help me do one or two things. I saw myself doing them. Am I communicating? I have worked in a place where it may sound funny, but because of my understanding, I work in a place where I pick broom myself, sweep all the place, even mopped. I did it. It may sound funny, but I did it. I understand how it works. Will I say because maybe due to issues on ground, in place and working, I will not say, no, it's not my duty. How can a pharmacist put this? How can a pharmacist sweep? No. Oh, I can't do that. And I'm working in a dirty environment. Does it make sense? It's not what I should do. But in that situation, you have patient to attend to in few minutes time, and nobody is there to do it. The place is messed up. What are you going to do? You have life to save. Will you lock it and go and say, because nobody is there, that your work is different from other works? You are saving life. Don't you sweep your house? Even if you want to make a formal complaint or there's somebody you want to sack, keep the place running first. Then you can now, after attending to your patient, you now make fire who you want to fire. I don't know if you understand where I'm going to. Now, when we come down to the tree now, everything that has to do with cleanliness and tidiness of a particular where the pharmacy is in the jurisdiction of what? Pharmacy technician. Fine, if you work in a place where they have enough staff, we have cleaners, those that come and clean. It's you. If they don't put the place in order, it's you that will make reports. It's you that will find out what is going on. Not for pharmacists. The pharmacist will come and say, what's going on here? It's you ask, why is this place like this? If there are people that do that, you find out why they have not. In fact, if you come to office first, you make sure that the place is in order. You may not be the person to do it. Reach out to those that should come and do it. They should come and do their work. Then, if you see yourself in a place where nobody is doing it, you do it yourself. You do it. If you are employed in a pharmacy where it's only you and the pharmacist that is there, so you come to work and say, no, I can't do this. You will go now. You cannot work there now. You will go now. Of course, if you can't fit in, you resign and go now. True of us. So you have to do it. Then even if you think there is need for it, with time, you discuss with your firm, sir, we need somebody to be doing this, so it's distracting me from my work, blah, 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 blah. If you look at the situation and think that he or she, the company can afford somebody extra, then you can do it. But if the company cannot afford somebody extra, you have to do it. Or you resign and go. I don't know if you understand where I'm going to. But when it comes to maintaining orderliness, cleanliness of the where you are working is under your what? Jurisdiction as what? Pharmacy technician. So that's the point I'm trying to make. Not that you be where they are working, and sometimes you may even be in a particular establishment where they have cleaners. You know, some people can be nonchalant, and the cleaners are doing what they like. They don't care. If you call them, they just look at you from head to toe. And sigh and leave you. Your pharmacy is dirty. What are you going to do? You report. Okay. If you report, what next? Then after reporting, you come back to your pharmacy and stay where is the dirty to work. Good. That is the point I'm making. You see that even if PCM comes, you see the question. What's going on here? The pharmacy, they hit on the what? For the farm. If you hit on you, then you go to hit the person that look you less. Even if the person will be sacked, the place should be kept what? Running first. It will be evidence that this person is not doing his or her work. If I were, the first thing I will do is to do what? Snap that place first and keep evidence. If there's any conversation I had with the person, I'll keep it as evidence. Where he lashed me that he's not going to come and clean it, I'll keep it as evidence and clean it. If possible, I'll even snap. If it's possible to even take video of me doing it, I'll do it and keep and file proper reports. File a very good report. The person is going, but before then, you have to put the person on the record. If you don't put it on that, you have failed. 2, in your duty. The same way a pharmacist is working with a pharmacy technician that she doesn't know what he's doing, you cannot keep your work hanging because the person working under you is not serious. You have to do it first, so that the person even if it takes you 1 month to do it until you get a better replacement, you do it. So that's what I'm making. So they support for pharmacy technician, also support pharmacovigilance by recording patient-reported issues. I think I mentioned. Was it in this class I said something about pharmacovigilance? Okay. There are situations whereby some drugs, these drugs are. I'm not talking about medicine now. Drug itself, exactly. Drugs are. There are stages of drug discovery, clinical trials, and what have you, before a drug can be approved to be safe. There are stages of trials, experiments, and research work to be done. Then, during the clinical trials, there may be some side effect of a drug that they did not discover, or adverse effect. They use in clinical trials. They use human beings, not rats and the mice and the monkeys. They use human beings to do clinical trials. It's when it passed the level of rat and all those ones, and show that it's not toxic. When they come to clinical trial, and they will not look at the effect on human beings. Exactly. Now, sometimes you may not get all the side effect of that drug during that period. They will get some. There are some that will manifest when the drug is already in the market. Maybe some may be idiosyncratic, depending on individual anyway. Some may not be that they didn't get the sample size that can give them that. But at the end, when the new drug is already in the market, they may start seeing some people will take it and start manifesting 1 or 2 effects. Now, the process of getting those information about the post-marketing, we also call it post-marketing surveillance, when it's already in the market, watching the drug to see whether there's any other effect. How many of you have seen MDEX before? MDEX. How many of you have seen MDEX before? MDEX. Okay, MDEX is a book that contains some drugs, mainly drugs in the Nigerian market, their brand, company, their dose, indication, what they do and what they cannot do, their side effect. At the back of that MDEX, there is a yellow paper there they wrote it National Pharmacovigilance Center, something like that, in NAFDAC. That paper, that yellow paper, if you go through it, you see some things that has to do with reporting of drug effects. So that is what a pharmacy technician play also a role to support in that pharmacovigilance, to report maybe where you are working, be it hospital, be it community pharmacy, patient that take a particular drug, come back and say that this drug is doing so thing to me. You put it down as something that is not even normal side effect or adverse effect of that drug. The same way, all those things will be sent to what? NAFDAC. The same way, if they keep receiving the same thing from different areas on that particular drug, and it's different from the normal side effect they know about this drug, it will start pointing towards something that this may be a side effect or adverse effect of this drug that is they did not record before. They will do what? Compile it. It will serve as a point to look more into that drug, to find out other things they need to know about the drug. Is that clear? So now, when it is certified that this thing is not just an individual stuff, that is a widespread this thing, it will be added as part of the what? Side effect of the drug, or adverse effect of the drug. But if the other adverse effect is so adverse that is life threatening, and they may even withdraw the what? The drug. Is that clear? So these are things. So all these things about checking this effect is what is called what? Pharmacovigilance. Pharmacovigilance, or post-market what? Surveillance. So the pharmacy technician support pharmacovigilance by recording patient-reported issues. So they can report record. Pharmacy technician can support by doing what? Reporting such thing. So at the end, the pharmacist will now compile and send to NAFDAC. But if it's something that is normal with that drug, it will not make any what difference. But if it's something that is not normal with that drug, then it will point to at something needs to be done. Now let's look at the relationship between pharmacist and pharmacy technician. Let's look at relationship between pharmacy and the what? Pharmacist and pharmacy technician. Of course, we have been saying this. I've been saying this from the beginning of this course. Pharmacy. Hello. What does it say about pharmacovigilance? Class rep, tell me. Please stand up. Tell me what I said about pharmacy for pharmacovigilance. Why? For the past 1 hour, you have been. What is your problem? You are a class rep. You should be a role model. For the past 1 hour, I'm watching you. You are doing something else. And because of you, I made 1 or 2 statements, thinking that, and you joke with it too. I made statement because of you. I saw you doing other things. Because of you, I made that statement, and you laughed and joked with it. You continue what you are doing. Now, for the past 10 minutes, I've been talking about pharmacovigilance. She was not listening. Now she said that she did not pay attention. What is wrong with you people? What is your problem? Sit down. It's not me you are doing, no, you are doing yourself. It's not me. It's not me you are doing. Hello? You are doing yourself. I've trained, supervised 5 sets of pharmacy technicians. So when I say you are doing yourself, just know you are doing yourself, not me. That's the only thing I can tell you. All right, so The pharmacist and pharmacy technician, they collaborate. There should be a collaboration, not competition. They should do what? Collaborate, not what? Competing with each other. So pharmacist and pharmacy technician collaborate closely to deliver medication and health care safely. They should collaborate, not compete. If they collaborate, they work together to do the right thing and to save patient, help patient. But once they compete, there are a problem. So technicians, pharmacy technicians rely on pharmacists for guidance. Pharmacy technician rely, hello, toucher. If you are feeling sleepy, you can stand up, okay? Pharmacy technicians rely on pharmacists for what? Guidance. While pharmacists depend on pharmacy technician for daily operational support. Pharmacy technician rely on pharmacists for what? Guidance. While pharmacists depend on pharmacy technician for what? Daily operational support. So in order to achieve this depending on each other, there should be what? Mutual respect. There should be what? Mutual respect. Pharmacy technician should respect the pharmacist, and pharmacy should do what? Respect the what? Pharmacy technician. And there should be what? Teamwork. They should work as a team. Then in all, they should focus on patient care. They should focus on patient care because focusing on patient care is crucial, very, very crucial for effective working relationship. So they should focus on patient care because their focus on patient care is crucial in what? For an effective working what? Relationship. So takeaway is that pharmacists and pharmacy technicians should work as a team, respect each other mutually. Pharmacists depend on pharmacy technicians for daily operational support. Without pharmacy technician, I don't know how pharmacists will operate. It is not going to be easy on them. Then pharmacy technicians should depend on pharmacists, rely on pharmacists for what? Guidance. Very important. So let's look at what and what, how pharmacy technician can build a great, wow, I like that. Keep it up. I have saved a soul. You are saved. You are saved. Let's continue. No, I say that we are looking at what? Building a great relationship. So we want to look at how pharmacy technician can build a great what? But it's not easy. It's not easy. It takes skill. You have to know what and what is involved. You must be intentional in building a great relationship. It's not what you just do, wake up and do it. You must be intentional in doing that. So let's look at what pharmacy technicians should do to be able to build a great what? Relationship. Because it's very, very important. If you want to excel, you must learn it. It's very important. So, number one is that pharmacy technicians should learn continuously. You should learn continuously. You should be teachable. You should be willing to do what? To learn. That's one thing. Here in this class, I've seen a handful of you that if I look at them, I see the enthusiasm. They are enthusiastic to learn. I see them. And take it or leave it. By the time we start writing quiz now, these are the people that will be doing well in my class. It's natural. Because they have been, from the beginning, their mind is there. Then we'll see people that are scoring 0, 1, 2. I already know them, but even by sitting down here watching you, I already know. In fact, I have already classified. I have already know those that will score A in my course here. without even writing the exam. I have seen them. Because how you perform in my course start from what I see you do in my class. There's no magic. You cannot do magic in my course overnight. That's one thing you should know about my course. You can do it in other course and succeed, but not in my course. You cannot do magic. I already know those that will score A, even in my class. I know them. That's how I program any course I teach. It's not after playing, whiling away your time. Overnight, you come and you're struggling to even get 40. If you have been playing in my class, it's natural. I'm not doing it intentionally. It's just how it is. So those that are serious, take it seriously. Be doing what you are doing. Karma is watching you. And law of karma does not change. Is what you give, you do what you receive. That's natural law. If you give nonsense, you receive nonsense. If you give your heart, give your mind in what you are doing, you will see it. There's no magic. You can't do magic. So you should learn what? Continuously. So what are you supposed to know? You should know pharmacy laws. You should know pharmacy laws, pharmacy ethics, and operational guidelines. If you're not the type that is willing to learn, tell me. You cannot, the pharmacist will not take you seriously. True of us? Yes. And there are a lot of things you will learn by just showing that you are teachable. If you show that you're teachable, someone will always want to bring you close, even formally and informally. He want to bring you close to offload whatever knowledge he has in you, because you know that you are willing, you want to learn, you are enthusiastic about it. Pharmacy Christian, another way is that you should get certified. Get certified. You are here to get certified, right? Because after here now, you get your certificate, right? You after passing through the training and pass your exams, you get your certificate here in school, and also get your license from where? PCN, right? Now, so if you get certified, certification from PCN, Pharmacists of Nigeria, builds competence and trust. Yes. If as a pharmacist, or even a patient is aware that you are a certified pharmacy technician, there is trust and confidence. True of us, the person will have that you know what you are doing. When I came here, one of the first things they asked me was my license. Even though I was blowing grammar that I've been teaching blah 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 blah, they wanted to see my. They asked for my what? License. Immediately they saw the license. He gave them that level, that confidence. This person is a pharmacist. True of us. And for me to get this license, that means and get the license over and over and over and over and over. My first license was in 2011. How many years now? My first license was in 2011. How many years now? 14 years. So for me to be getting it for 14 years, that means this person is a strong hand. It's not just a baby that just even a pharmacist that came out today is still a great person. So I'm trying to point out the confidence and the trust it gives to whoever you are dating with, that this person is a what? Pharmacist. That confidence is there, and it will help the relationship to do what? Cement what? Well, with respect to care of what? Patients, or even teaching as I'm here. Let's assume they ask me about my license and I start blowing grammar. You see, when I now, wait, it is not like that. It's just that I was like, they will not have the confidence to say, apart from the fact that I have been teaching, but that license is very important for them to be sure that I can handle what? Pharmacy technician students. So the same thing with you as a pharmacy technician. If you are certified by PCN, any place you go tomorrow, there is trust that this person knows what he's doing. True of us, and it will cement that relationship. Then another thing you should also do is that you should learn how to ask questions. Ask what? Questions. By asking questions constructively anyway, it shows your willingness to do what? To learn. Don't be so. It shows your willingness to do what? To learn. You don't argue, but ask to do what? To learn. Not asking to show that you know it. No. It's asking to learn. And if you make a mistake, if they correct you, say thank you. Even if you may have a superior argument, say thank you first, go back first, and look into what you discuss. If there's anything you think you can say, you can come back another time. Not do this. No. I can't. No, this thing is not. No. Like some of you here we are foolishly doing. Go out. You are arguing. You are even exposing yourself the more. Just quietly go out. Do it first. If there is anything you think you want to say, another time you can bring it up. With that, you are building a good relationship. I'm telling you how to build relationship. Do this, no problem. This thing you did is wrong. Go, thank you, sir. I will not do it again. You don't stand there and start saying, sir, I did it because. No. Say yes, sir, thank you. I will not do it again. There you go. Sometimes when you now sleep and wake up, you now see how foolish that argument you wanted to bring. It has happened to me. So I'm telling you from experience. I can argue for Africa, for the whole world. But as I was growing up, I came to realize something, that you must not be right. Sometimes give space, allow some things to be. Go back and think about it. Sometimes I'll just be like, hey, thank God I didn't even start argument on this issue. I would have made a fool of myself. Because at that point in time, you are right. Nothing everybody is saying is correct. You are the one that is right. Everybody is wrong. But if you learn how to say, okay, I'll look into it. Okay, thank you, sir. I will not do it again. You go back. By the time you wake up, you now start seeing. And some bosses may not tell you reason why they are doing some certain things. Maybe with time you now understand why you said you should not do this. You should not do this. You should do it this way. So if you learn this thing, how to relate with the people you are working with, your boss or whoever, it will help you to grow more in your profession. In the what profession? You may think nobody nobody holds my destiny. Yes, nobody is your God. I understand, but God cannot come down on earth. It's human beings that God walked through. True of us. Then that's a human being that God walked through to put you in a better place. You are there showing them that you. I'm saying that God no go shame you. God can never come down from heaven to help you. Where you are working, in your school, here now, in my school. Sometimes if I say some things, I like saying some things because it's important. Even though it may look at I'm blowing trumpet, but sometimes to teach, you blow trumpets. Sometimes it's very important. Till today, my lecturers in school still follow me up till today. Till today, as we speak, till today. Why? I am not a saint, but I understand. I know what it takes to build a relationship. That anywhere you go tomorrow, Today till today, they still write recommendation letter for me till today. Many of them. All I need just tell them, they just write it and send. Professors up and down, they say write and send. Why? I left school since 2011. Why? If I was there with them doing nonsense, would I even have the courage, the justification to even talk to them? I cannot do it now. The HODs I work with till today, if I just call, sir, please, he wouldn't allow me to finish. He will send a boom. He will construct wonderful write-up. Why? I have my fault, but I try. Even if I make a mistake, I will ask for forgiveness immediately and take correction and keep going, because I know that everything doesn't end there. That's why if I see some of you as foolish as you are doing it, I'll just be laughing. So learn how to build that relationship. It's very important. You can make mistakes, perfect. But if you err, accept that you err and do what? Ask for what? Forgiveness, and show willingness to learn, and you keep growing. So even if you don't learn, you thank God is part of this topic. Most of this argument we are doing here is part of that relationship. Look at the one I spoke to. She was there arguing with me, murmuring, talking nonsense. I sent her out. She stood there for like 2 minutes talking nonsense. Even when she was leaving, she was still talking nonsense, going, and I was busy watching her. Exposing yourself. See, by virtue of you passing through the school, it's like you have used rope to tie yourself without even knowing. There's a rope that you are not seeing. By registering here, there's a rope you're not seeing that you have tied yourself to this school. Even if you leave this place tomorrow, one thing or the other will be referring you back to this place. Take it or leave it. You may not understand it. Take it or leave it. I left UNS since 2011. I'm still tired, even though I have not stepped my foot there for almost how many years now? Going to 8 years now. I have not stepped my foot in UNN. But I'm still tired there. Why? So if my record there is nonsense, my relationship with those that taught me nonsense, I am inflicting wound on myself without even knowing. So please let us, so some of you do this out of ignorance, not knowing, because the future you think what is there? Let me just do and go. No, you didn't know. It's not that you're not just doing and going. You are building something for tomorrow. So be careful about what you do here. Be very careful about it. One of my students, they graduated in 2020 to 21. We are very close. A girl, very, very close. Now, I saw an advert about job. I sent it to her. So she picked interest in, and she applied for the job. Do you know that when she went for that interview, the HOD of that hospital pharmacy where she came for interview, the HOD taught her in our school. The HOD was one of the lecturers in our school when she was still in school. Now when she now went for that interview, the HOD that headed the panel, I was one that referred her, that sent her I saw the advert and sent it to her. She applied on her own. When she now went for the interview, the person she saw, she was the person telling me that HOD is the lecturer that their AUM lecturer. Then I was the dean of studies. Their AUM lecturer was HOD sitting down to interview her for the, what is it called, job. Now we were close. Let's assume I trained her in such a way that she don't pride herself, that she didn't pride herself that I am close to the dean of studies. If she was doing like this and the lecturer speak to her, she should do whatever she likes. Now tell me how she would have faced the immediately she saw her, she was like, wow. The angel was even happy that my students came for the what? Interview. You see how this is work. I had left that place since, so I was in Lagos that time. I just saw the advert and said to her, she had left school for almost going to 2 years. I just saw it and said to her. She went and told me, do you know that the HOD there was our AUM lecturer? I was shocked. I asked her, what did she say? Because I was afraid, because I didn't know whether she has messed herself up when she was in school. I asked her, out of fear, what did she say? No, immediately she saw her, she was happy. My mind relaxed. And she got the job. So what am I saying? Be careful about what you do here. Be very careful. Be extremely careful. Not just to lecturers alone, no, even to your fellow students. Your fellow student here can be your employer tomorrow. It can be somebody, it may sound funny, but it's a fact. It can be somebody that can link you up tomorrow for something. So be careful. Build a powerful relationship. You gain nothing showing off. You gain nothing. Even if there is an issue, sort it out and keep going. So then, to build a relationship, you should also be a team player. A former secretary should also be a what? Team player. You should be a team player. So what it means is that you don't compete, no, understand. Please. I am an Igbo. In Igbo land, we call a hospital Uno. Uno is house. Ogu means what? Drug. House, where they have what? That's what we call hospital. Traditional Igbo language is Uno. Now, sometimes if you come to healthcare setting without drug, what are you doing there? Check it now. A hospital, right? Then after the doctor will see you and there's no drug to treat, what are you doing? Nothing. So if you start looking into it, we have a lot, we play pivotal role in what? Healthcare what? The delivery. You cannot do anything without our product. True of us? Yes. But you cannot come and stay and start looking at others as what? Inferior to you. No. You work as a team. That you know about drug, you produce, manufacture, dispense, give guidelines on drug and everything. There are some other people that we also find out the disease. True of us, do diagnostic tests to find out what the person is what suffering from. True of us, before that your drug can be given. True of us, if your drug, if there's no proper diagnosis, your drug is wasting time. True of us. There are doctors to do their work too. So there are nurses to do what? Administer. So you understand, if you understand that all these healthcare professionals in the team have their role to play, then you know the importance of what? Respecting them. You know the importance of working with them as a team, not competing with them. Start showing who is what? Superior. Sometimes I don't know the type of orientation they give to some of our healthcare professionals, that when I don't know if any of you have witnessed that. If you be with some of them, how they behave, you be like, you look as if they have the mindset that they are the owner of the hospital, that you are just there to assist them. And I don't know if any of you have witnessed that. But that is wrong. I don't want that to happen. I don't want that I don't want pharmacy technician to be part of that nonsense. I call it nonsense. So respect, know that all of you have a role. Each of doctors have a role to play, medical lab scientists have a role to play, medical lab technicians have a role to play, even ordinary cleaner, they have their own role to play. Even even security man at the gate have a role to play in healthcare. You may not understand it until there is what is it called? Is it armed robbery? No, let me not go into armed robbery. Until there is and even all these porters, they have a role to play. Even though yes, they are not directly working with patients, but at least they have a role to. You respect them. You don't carry yourself. You have arrived. Don't you know that I am a pharmacy technician? Don't you know that I am a pharmacy technician? No, you don't look down on anybody. Respect them because they have a role to play. That person that goes to put gen has a role to play. So everybody has a role to play. You don't look at all these big ones. Respect the big boys alone. No, respect even the people under you. The pharmacy assistant attached to you that have only O level has a role to play. Very important. So you should be a very a good team player. So you support your colleagues for optimal patient care. Now, you should also be pleasant and helpful. Be pleasant and what? Helpful. So try as much as possible to maintain positive attitude towards patients and co-workers. One thing I have come to learn from life and experience is that I've learned what it takes to maintain positive attitude. No matter what situation I see myself, I may be angry about something, but everything, all my intention, I force myself to do it. Human nature is not that way. I force myself to do it, to always maintain a positive stand. I may have issues to drag and have problem with you, but at the end, whatever I'm targeting is to maintain a positive stand from that situation, not to just quarrel and scatter everywhere and go. Even if I'm saying something or I'm lashing out at you, at the end is to make things right. If you employ that in what you are doing, it will help you a lot in building relationship. Not just about having let me show him I can talk, let me finish him up, let me just deal with him. No. Always have that mindset that no matter what, yes, there must definitely be an issues. It's normal. There will be fallout. But at the end, what matters in that fallout is how do you have positive attitude towards that? After that, what happened next? Did you resolve it? Did you tackle it? Did you find a way to strike a balance? That's what we mean by maintaining a positive attitude. If at the end of the whole thing you realize where you not do well, did you finally open up and discuss it and sort it out so it doesn't happen again? That is maintaining positive attitude. Or do you scatter everywhere and go? Tomorrow you see tomorrow you see each other. If you know that it's two of you that should work shift, you will work into that they will do what? Change you. No, because you had this issue with the person. The person is there waiting. He will pass you what you should work with. You will not work with it. You look at him and go. And the patient is what? Suffering because you are fighting. It's foolishness. So, in your relationship with other health workers, pharmacy technician, and the other health workers, you must maintain, I think I've said this now, you must maintain respect and what? Honesty. You must maintain what? Respect and what? Honesty. Respect and what? Honesty. Very important. And you should also make a priority, very important, make it a priority, patient health. Make a priority your patient what? Health. So if you make your priority a patient health, if the patient health is your priority, you will see that, if the patient health is your priority, you will rarely have issues with your fellow health workers. And even if you have issues, you will try to do what? Resolve it. Because you know that if you keep having issues with them, your patient will do what? Suffer. So if truly your patient health is your priority, you rarely have issues with people around you are working with. Then because of human nature, which is normal, and you have issues, you will try to do what? Resolve it. Because you know that if the issue lingers, it will affect your what? Patient. So that's why we say make your patient health your what? Priority. Very important. Then of course there should be mutual trust, because mutual trust ensure the effective healthcare what? Delivery. You don't second guess, just look at issues. Trust the person you are working with, except it is obvious, very very obvious, that this person is not what? Excuse me. Except it is very very obvious that this person is not what? Serious. What's going on? Is there issue with NEPA? What's going on? My system is even down, sir. What is going on? So, are we together? Huh? Someone say no. Don't worry, I'll soon go. I know you're tired, I'll soon go, don't worry. Alright, I have 2 minutes to go. Now, let me conclude with your relationship with patients. Very important. Let me conclude with relationship of human technician with patients. In fact, even though it's not, your relationship with your patient is personal at the same time complex. It's what? Personal and what? Complex. There are a lot of factors to put into consideration. You should be empathic. You should be what? Very, very what? Empathic when dealing with your what? Patients. You as pharmacy technician, you play a vital role in patient education and wellness. So don't say you have nothing to contribute unless you don't know, or unless you waste. If you waste your, unless perhaps you waste your time here in school as a pharmacy technician. But if you follow everything you are doing here accordingly, you see that you know that you have a very important role to play in patient what? Education and what? Wellness. So there is also should be a balance between business goals and patient care. Remember I said something before now. I told you that if your aim, if the reason why you apply to this school and get admission into pharmacy technician is money, that you should go. Hello. The first time I entered class, I said it and I mean it. That if your mission is to come here and money is your goal, your vision, money. Please, I told you that after that lecture, just go back and carry your bag and do what? Go. Because the aim is not what? Money. So you should balance the business goals at the same time, patient what? Care. You must balance 2 of them. Of course, if you take care of patient well, money will come. True of us. Because the patient you take care of today, tomorrow will come back, right? then we tell other people that this person is doing well, and they will come. And of course, now when they come, money will come out, now, true of us. So why not focus on taking care of them, not their money? Because if you focus on taking care, if you focus on their money, a time will come, it will be clear that what you care for is what? Money. And they will do what? Run. You will not last, they will run away. You may boom, but you won't last. But if they know, if they have the perception that you care more about their welfare, their health care, their health, the money you will see, you say will be running away from money. Because they will be coming. More will be coming. You don't even need adverts. More will be coming. Because as they go out, people can ask questions on daily basis. Please, do you even know a good place I can get? Someone can attend to me about this. People ask that question on a regular basis. Now, somebody you treated well will always say, there's one person here. In fact, if you go there, you won't think it's a pharmacy. The way the person attend to us, that lady or that man is too much. He will go. All right, someone say thank you, sir. I know my time is. I have extended my time. Good morning, sir. Fine, sir.
What are you seeing here?
Okay. All right. Do you have any question? All right. Thank you very much for your attention. God bless you. See you next time.